So 1 out of 163, 162 no's. So 1 yes only, and that too was a surprise. But I think it's your resolve, it's your resilience, it's your passion, it's your belief in what you're doing. It's the people around you who also believe in the same vision and they have the same passion, like my team, my daughters in case of my personal life, who kept me going forward and get the job done.
That one yes turned into $6 million in Series A funding, fuel for MedIQ, a healthcare platform reshaping access to Saudi Arabia and Pakistan, led by Dr. Saira Siddique, a physician, a healthcare specialist, and one of the most determined founders you'll ever meet. It's now setting sights in Canada, North America, and beyond.
Hi, I'm Saira. I am a physician by profession, but a black sheep who decided not to work on individual patients, but to work on healthcare systems. So I later on pursued my master's in public health and then studied a bit more to do my PhD in health economics. Worked in corporate jobs for about 22 years before I had a life-changing moment when I decided to move away from all the cushy jobs and start my own startup called MedIQ. It's a health technology company, currently functional in 3 countries. Having served more than 4 million customers very proudly, and we have recently closed our Series A funding. It was actually an accident which made me create an impact which I wanted to create, because when I became a patient and I saw the gap in the system and I was myself a victim of that fragmentation, it was at that time I decided that now is the time when I have to take the action, otherwise people like me would keep on suffering. I was always complaining about the system, this is not working. I should have been at home because I was recovering. I was more on the rehabilitation side, not on the active treatment. So I always thought that, hey, what if I was surrounded by people who love me and still get treated? But I think the moment when it changed, my whole thought process was when I saw a lady about 80 years of age, and I saw her waiting in a long line just to get her medicines for hypertension, which is like a routine medicine. And still she was counting the money in her bag to check if she has enough money to go back to her home, so she has a bus ticket or not. So that was the moment when I said, no, it's not only for the people like me who can somehow afford to have the luxury of paying for the healthcare system from their own pockets, but people like them who are millions in numbers, who have access issues, not just because of non-availability, but because of the financial reasons, because of the geographical reasons, because of the social reasons. So that old lady was my inspiration.
Her turning point was not in a boardroom. It was in a hospital room, watching patients struggle to afford care. That moment became her mission. Initially,
MedIQ was a very simple idea. The MedIQ initial MVP was to help the patient stay at home, and when needed, they come to the hospital. So the concept of a hybrid healthcare system.
To bring MedIQ to its next chapter, Dr. Saira joined TBDC's Land and Expand program. And over the course of the program, she connected with Canadian mentors, investors, and partners, building the foundation for her North American presence.
By improving healthcare, you still get positive unit economics. You are looking for money, you want your returns, and healthcare is a business where you don't only get the returns, which are like many times higher than many other industries, but at the same time, you're impacting lives of the people by changing the way the healthcare is delivered to them. So you're creating impact while you're also getting the return which you need. So do it in the right way, invest in the right founders, invest in the founders who are mission driven, so that they actually do the business in the right way. I faced a lot of pressure from my family not to work at odd times and everything. I remember it was December and I was pitching to an investor in the US. So it was like 12 at night in my country, and it was 12 in the afternoon because that person was on the West Coast. But the investors were not ready to be flexible. So I had to tell to my family as well, and to the people around me and to the society, sorry, this is how it works. The number of the women, even solo founders like me, who are being able to scale and to provide solutions which are working in multiple geographies especially, they're increasing. So I won't say that it's my gut feel that, or my own bias that women should be in this field, but it's actually being proven by the numbers. At least in the region where I am working, most of the funding has been raised by women in the area of health technology. So this is something very encouraging at the same time. So maybe I was the first drop of rain, but then I see more drops following me, which is very heartening and very encouraging. So 1 out of 163, 162 no's. So 1 yes only, and that too was a surprise. But then the next 3 ones were yes. So I was expecting no's, not as many as I got, but I was like cool about it, because I knew that not everyone is gonna like my idea, not everyone is going to be sold on that idea. I always, as I said, go for it, because the time is now, the time is right, the time is perfect, and you have it. You have what it takes to do it, to make it happen, to make it successful, to make it big. So go for it now. Don't wait for anything.
She didn't stop at 162 no's. She continued on and proved that it only takes 1 yes. Here at TBDC, we will continue to cheer her on as she brings better healthcare access across North America.